the challenges of the corona pandemic. We're very pleased to have all of you here. This is a collaboration of the Social Sciences Center of Health and Wellbeing of our faculty and the Aletta School of Public Health. And actually, just to briefly introduce the center to you, because we're fairly new. In fact, we were supposed to have our opening pretty much a year ago, but as you will have realized, that wasn't possible. The aim of our school is to connect researchers within our faculty who are interested in understanding behavioral and institutional underpinnings of having a healthy and active and socially connected life across the lifespan. And so the center has been starting up in this first year, and we're really happy to be organizing this symposium, which fits very well into the aim of our center. You can see the team here who's been co-organizing the symposium. And well, for today, what we're going to be talking about is the corona pandemic, and we have a setup of, I think, very interesting speakers. Just to give you the program, we will be starting more with a social scientific perspective on corona. So John Drury about the role of group processes in understanding the corona pandemic, and then Pontus Leander from our faculty will talk about how one studies a pandemic in real time, and he'll be talking about his See Corona cross-cultural study that he set up in many different countries. And then we move a little more on to the intersection between policy and science with Michel Dückers, who will be talking about a public health perspective on corona. So I'm really pleased to have this set of speakers today. Welcome, all three of you. We'll be, by the way, ending with a panel discussion. And before I introduce the speakers, I would just briefly like to give a few sort of rules to let the symposium work well. So I think most of you have done that already, but please make sure that your microphone is muted. If you have internet problems, you can turn off your video, but if not, that's fine to leave it on. There will be two moderators today, so we will see we have these three talks, and per talk there'll be about 5 minutes for questions. You can post your questions already during the talk in the chat, and we will try, of course, to answer as many as possible. And we, being the moderators, myself and Gert Stulp, who you just saw on the photo here as well. Then just one final point, there's different ways, you may not know Blue Jeans as well, but there's different ways of looking at us here on the screen. So on the bottom left, you can put on a gallery view or different types of settings. So it might be nice to try that out for you. I think gallery view is nice to look at when we have our panel discussion. So I just wanted to let you know that you do have some options regarding how to see us. Okay, well then I'd like to just briefly introduce the speakers, and I'm going to introduce the three of them now so that we can just move through the talks without having me back in again, disturbing processes. I'm going to move from back to front, so I'll start with the last speaker and end with John, who will then immediately give his presentation. So the third talk will be, just to give you a brief idea, by Professor Michel Dückers, who has recently been appointed by special appointment as a Professor of Crisis Safety and Health at our faculty. So we're very pleased to have you here, Michel. In his other working life, he works as a research program coordinator on disasters, environmental hazards at the Netherlands Institute for Health Services Research. So that makes him, of course, he has this intersection between scientific research. So he does quite a lot of scientific research on safety and health effects of exposure to disasters, and on how governments, private and public organizations should respond to disasters. So he has that scientific side in which he studies disasters. And on the other hand, this very applied aspect from the work that he does, he's involved in advising national and local governments in public health crises, in a lot of different public health crises. So he has a very interesting perspective, I think, for the symposium today on how to manage crises. So that is Michel. The second speaker is Dr. Pontus Leander. He's an associate professor of psychology, also at our faculty. For his own research, he's very well known in the area of social cognition. He studies unconscious motivations and goals. So, for example, people's motivation to why they would implicitly want to pursue drug use, or goal pursuit versus apathy, very interesting research areas, and more applied. In recent years, he's done a lot of work on people's motivations for gun ownership. But today he will be talking about the large-scale study he set up surrounding the corona pandemic. Then finally, I'm going to move to John. And actually, John, we invited quite a while ago. So when we first invited John to give a speech here, we invited him to talk about his research on collective resilience in mass emergencies and disasters, one of his research areas. He's very well known in this area as well, and we wanted him to give a talk at Aletta about his work. But then came we don't call it a disaster, but certainly a pandemic, a crisis, and suddenly John wasn't able to come, and the topic of his talk became different because he told us about his very interesting research that he's been doing in the past year on the corona pandemic, and we asked him to talk about that instead of his other work. When John isn't studying pandemics, he in general looks at crowd psychology. He's very well known in this area. He also advises governments regarding crowd safety management. So I think John also works very much at the intersection of science and practice and is very active in making sure that research insights from the behavioral sciences are applied in practice as well. And regarding the corona pandemic, but I'm hoping he'll talk about that a little himself today too. He is a member of a task force in England who indirectly, at least the way I understand it, advises the government regarding corona policies and the social scientific perspective on corona policies. So John, we're really pleased to have you here today. I'm going to end my presentation so that you can start yours. And I want to say welcome already to all of our speakers. So I'm just going to come back to Blue Jeans. I'm right, John, you should be able to upload yours now.
Thanks, Catherine. Just got to find my slides. Here we are.
We can see them.
Okay, good. So, yeah, thanks very much. As Catherine said, I study disasters and also public responses to the pandemic. I've been doing research on public responses to the pandemic, in particular on mutual aid groups, which I shall talk about a bit at the end. Mutual aid groups who help people self-isolate, stay in their homes when they need to. I'm also on a advisory group advising on behavioural elements, particularly things like adherence. Now, whoops, there we are. So, you know, why am I involved as a psychologist in what is a medical matter, a disease, biological matter perhaps? Well, as we all know, what people do, behaviour, has been key throughout this pandemic. We call them non-pharmaceutical interventions, by which we mean all the things that we've all been doing over the past year. Physical distancing, hand washing, staying at home when we're asked to, wearing face coverings, self-isolating. So psychology has been absolutely crucial. But I'm going to say also, it's not only psychology, there are also practical matters that as psychologists we should be aware of. There's a bit of an echo. Why? So what I'm going to do is talk about public adherence to these behavioural requirements, focusing in particular on the role of group and identity processes, because my background is as a social psychologist concerned with identities and groups. So I'm going to talk about variations in the extent to which the public have adhered to the required behaviours. First of all, over time, changes over time, and secondly, changes or variations in relation to the type of behaviour required of us. Now, at the in the UK, at the very beginning of the pandemic, before we'd actually locked down and so on, there was a concern amongst those in authority that the public would not be able to endure these privations of staying home and distancing and so on. And this was expressed in the concept of fatigue. Even the chief medical officer used this term to say we should hesitate in asking the public to make these sacrifices because they won't be able to endure it. But what was found subsequently was that across the year, adherence rates for staying at home, for distancing, were very high. Overall, were very high, and that is not only on people's self-report measures, but also when you look at behavioural observational data, you found the same pattern. Overall, I think most commentators would agree that the public response has been extremely good. And you only got to look at lockdown. I mean, lockdowns have been effective, and that is public behaviour. A couple of my colleagues wrote a very good review of the concept, critical review of the concept of fatigue, and found little evidence that it helps us to explain the patterns of behaviour, because one might expect a kind of linear decline as people get more tired over time of the measures, and that isn't the case, certainly not in the UK. So adherence has been high, and as you might be aware, there are a very large number of publications now looking at psychological predictors of various required behaviours. I'm going to focus here for now just on physical distancing because it is a very visible manifestation of the behaviours we're all required to undergo. So lots of studies, survey studies, experiments, some of the studies better than others, but lots of them, and taken together, there is a recognisable pattern in the findings, or series of patterns, I should say. And the first predictors I want to mention are ones that should be familiar to anybody who works in health psychology, because any health psychological intervention is a function of things like the person's knowledge of risk, their perception of risk, but also their belief that the intervention that they're being asked to take against the threat is effective, and that is the case too with physical distancing. But in addition to these these factors, there's a whole series of factors that can be broadly called group or identity related processes, whether one's own group, the wider category, other groups, and so on. So the first, and this comes across time and time again, is social norms. What other people are doing is a predictor of whether we will distance. If other people are distancing, we will distance, right? And of course, it really matters who they are. So the more relevant those other people are, the more likely we are to distance. Then there are studies looking at various levels of identification. So quite a lot of these, national identification. There's a very big international survey found it was a predictor, a weak predictor, but a predictor. A stronger predictor was found in a study by my colleagues of mine at Sussex, found identification with the family was a good predictor. These are mostly self-report, by the way, but I'm aware of a study also that found that self-report data on distancing correlated well with observational data of the same behaviour. And then there's the other groups. Empathy for those most vulnerable has been found to be highly predictive. There was a survey carried out in Germany with a representative sample, and that was a key predictor. And then the government. So when trust is low in the government, that reduces adherence. But when confidence in government action is high, that they're effective, they're efficient, they're good at what they're doing, then that boosts adherence to physical distancing. So these are the predictors, and now I want to talk, as I said, about why adherence varies over time, because it does. And in the UK, we get a lot of discussion in the press about people not following the rules, and they're insulted in various ways. Members of the public are doing this in the press, and there's a big debate about this. So we need to understand how much is going on, first of all, and where it happens and what causes it. And in my discussion of this, I want to focus on a period in the UK where there was evidence of significant decline in adherence, right? And it's a period that covers May and July 2020. And there were three public events that affected, that were associated with a decline in adherence. I should say, though, that decline was relatively small, in that adherence for most measures remained relatively high, but nevertheless a decline. And I'm going to argue that in each case, these public events affected the psychological variables I talked about in the previous slide. So the first one was when the government, so what was happening by May was that the government were getting a bit more optimistic about the course of the pandemic, and they wanted to start loosening things up a bit. So they changed the messaging. The messaging originally, as you can see in the bottom left corner of my slide, was stay home, protect the National Health Service, save lives. But in May, they changed this to stay alert. Not stay at home, but stay alert. Now, anyone who's worked in the field of disasters knows that stay alert is a bit like stay calm, don't panic. It's not useful because it's not advice or guidance, recommendation about what to do. It's a recommendation about how to feel, how to perceive. I mean, stay home, it's a concrete behaviour. It's understandable, it's clear. Stay alert, much less clear. It's a bit vague. So there was a decline then, and there was also a decline in the in levels of public knowledge about the rules. And you can see the connection, because that vagueness, that poor messaging, muddied people's understanding about what was required. And as we've just said, as I've just said, knowledge, understanding is a predictor of adherence. The second public event came in the same month when, I don't know whether you heard about this, because I know I'm speaking to an international audience, but in Britain it was big news that a government advisor called Dominic Cummings broke the rules when he was meant to be staying home with his family, and he caught the virus, and he instead travelled to his parents across the country and took several trips out at the same time. And it wasn't simply that this was seen as rule breaking, but it was defended by the government, who made an exception for him, whereas other people were making these sacrifices. They were going without seeing their family, and they were being punished for not breaking the rules, whereas he was not punished. And this led to a lot of criticism and anger. And there was talk of there being one law for the authorities and another law for the public. And this was associated with a very good study by Daisy Fancourt and team at UCL, tracking public views over time, and they detected a decline in trust in the government associated with this scandal. And as I just said, trust in the government is a predictor. It was also associated with a general decline in that togetherness, that unity, that national unity, if you like, that sense of identity that happened at the beginning. Although, you know, I would probably add to that what we know from other disasters is that sense of unity that arises at the beginning of a disaster tends to decline over time anyway. So that declined, and that too can be associated with the decline in adherence. And then the third public event came in July, when the government further sought to relax the rules, and they targeted this on the 4th of July, which is kind of symbolic. It's the American Day of Independence. And so there was talk of freedom, freedom, independence, end of lockdown, in the week leading up to the 4th of July. And the media hyped this up more than the government wanted, I think, because the government backtracked. By the time they got to the 4th, they backtracked. So the relaxation of the rules was much less than expected. Nevertheless, in the week leading up to 4th of July, this fanfare certainly seemed to signal to many members of the public that the lockdown was finishing, and there was some evidence from some of the surveys that people's perception of risk declined around this time, which is consistent with the notion that these messages signalled that there was less danger, less need to adhere to the rules. So that is some discussion of decline in adherence over time. And I should say again that after that July decline, it certainly plateaued, adherence plateaued in the UK public onwards until winter. So now I want to talk a bit about variations over time with behaviour, because I've kind of glossed this up to now. I've talked about distancing and I've talked about behaviours in general, but if we break it down, we see some interesting differences. So hand washing, so people's adherence to hand washing, certainly at least in the self-reports, that has been consistently high, their adherence there. Mask wearing certainly went up. I mean, in the UK, we were one of the latecomers to the expectation and then the rule that people should wear masks, but when it came in, people readily adopted it, so that actually went up, so no decline there. Social contacts, I mean, this distancing and staying home in general, these factors, as I said, have been high. They do vary with things like the level of the pandemic. So as the peak rises, so people stay home more. As the regulations come in with lockdown, people adhere more. So you've got that variation, but overall high. And then the one that stands out, the one that's different, is self-isolation. So there have been a lot of studies of this, mostly self-report, but they do present the same picture, which is that not enough people are self-isolating for enough time. Now, what we're talking about here is the people that have tested positive or their contacts who are required in the UK to stay at home for 14 days. It's changed to 10 days now. Stay at home, not go shopping, etc., not go to work. So that 20% is the people that definitely do the full 10 days. The others, they'll go out 1 or 2 days. They might be going to work as well. So that is worrying, because that is a massive hole in the whole public health response. Now, the government, part of the government solution to that has been to try to threaten and punish people. So quite heavy fines for people who don't self-isolate in the way they are told to. Now, you might think that's, a commonsensical thing to do. It's intuitively correct, but if you look at the evidence and the mechanisms how this might play out, the government's own advisors, as you might know, some of them are modelers, and they published a paper in which they modelled what would happen if you added these large fines. This is quite early on when it was still being talked about, and they said when you include these large fines in the equation, what happens is that it puts people off self-reporting, right? So for a find, test, trace, isolate and support system to work, you've got to have testing in the first place. So, people aren't testing positive if they're not tested, right? So if you think you might get fined or your contacts might get fined, you're not going to get tested, you're not going to give the names of your contacts, right? So that's actually even worse. So fining is not, there's all sorts of arguments about punishments, but that I think is an important one. And the other thing to say is that some of the surveys carried out on self-isolation found that intentions to self-isolate, people what they wanted to do, was much higher than what they did. And that suggests that the problem of self-isolation is not really ill will, lack of motivation, it's something else. What is it? So the surveys have found that the main factors explaining why people don't self-isolate sufficiently are, first of all, people don't understand the rules very well, and also when they've got mild or fading symptoms, they think, oh, I'm safe to go out now. Now, these issues are issues that a public information campaign can tackle. So the first thing is information. But the second thing is financial. So the other key predictor of non-adherence is not enough money, feeling you have to go out to work, right? And you get that in the self-report data where people give financial reasons, but you also get it in the demographic data. So if you look at who it is that's not self-isolating sufficiently, you find that it tends to be the poorest workers, the people that think, okay, it's between spreading the virus and feeding my family. We do give £500 to people to self-isolate, but there's a lot of people that apply for that money and don't get it. So there are a lot of people not self-isolating for financial reasons. So the alternatives then, there's been a lot of discussion about this in the advisory groups and amongst people studying this. So obviously it's greater financial support. That's one solution. I don't know whether it's going to happen now. I think the UK government are now putting all the weight on the vaccine and basically ignoring everything else, unfortunately. But the other thing, of course, people need is help. Unlike wearing a mask, unlike distancing, you can't do isolation on your own. You need people to help you. You need people to do your shopping. You need people to walk your dog. You need people to collect your prescription, to send your post. You need emotional support. Who does that? In the UK, we've got, and I expect you've got this in other countries too, these mutual aid groups. This is a headline from the beginning of the pandemic when they got a lot of publicity. So thousands of these community support, COVID mutual aid groups sprang up across the country in people's streets. I mean, I've got one in my block of flats, but they exist at that level, the level of the street, the level of the district, the level of the town. They're networked across the country. But they are a fascinating phenomenon because they are not organised by the government. They are spontaneous, largely autonomous groups. And having studied disasters for a number of years, I realised that this is a manifestation of something we already know about, which is, well, it's got various names. One of the names is disaster communities, the way that the disaster creates a sense of groupness, it creates a new group, creates new identities amongst people affected, who then support each other and provide what people need in the times of a disaster. But one of the other things, and on the slide there is a very well-known book about this phenomenon, which I do recommend, covering a number of different disasters from the San Francisco earthquake to 9/11 to Hurricane Katrina. It's a really excellent book. But one of the things we know about these disaster communities is that they also decline over time. As people run out of energy, they run out of resources, they go back to work, the government steps in and starts controlling them. All sorts of factors lead these groups to decline, just at the time when they might be needed. I mean, we've previously looked at these groups in the case of floods, for example, and in the case of a flood, you are still affected by the stresses of the flood many months afterwards, but your group is probably finished by then, just when you need it. And so it is with mutual aid groups. And this figure is a tracking of 110 mutual aid groups that we looked at in terms of their activities on Facebook. So obviously Facebook requests and comments and responses is always mediated because groups move on to other platforms, but we know this ties in with other research that we're aware of, that the mutual aid groups, they might still be active, but there's fewer people in them. They're less visible, so there has been a decline. And our current research is to understand that, to understand it and try to help, because these groups are still needed, and they will be still needed for a while because the pandemic hasn't finished. So what we did was we interviewed organisers of mutual aid group. We interviewed over 30 of them. Maria is the postdoc leading this research, and we asked them, what are your strategies for keeping people involved, for keeping your group going, for sustaining your group over time? And they came up with a number of different strategies and suggestions. So when people in the group felt cared about, so you're thinking about the mental well-being of the members. When the group was organised so that everybody had a say, so it's horizontal, not vertical. When there was regular communication in the group, so they can't meet, and a meeting would be a way of consolidating the group. You can't meet, but if you can communicate, it makes people feel a part of it. And relations with other groups, getting support from other groups, being part of a network, and financial support. So some of them said, this is like a job, and I'd do it as an organiser much easier if I was financially supported. And we've got a website, an excerpt from which is there with some of our resources some of our materials that we've collected, which includes examples of good practice in community solidarity, mutual aid groups. So what we want to do next, and this is a model that depicts how we understand what the process might be. So we think that these strategies used by groups to sustain participation, they work on two types of factor. They work on some of the traditional predictors of collective action and volunteering participation, such as identification, perceived support, and identity with the community. So these things all get boosted by these strategies of communications, horizontality, and so on. It also boosts the sense of efficacy in the community, the sense that the community can act. It also increases well-being, but also reduces burnout. And we think that these things are factors in sustaining participation. So this is a model of what groups can do to keep themselves going, which we plan to share with the groups that we work with and others. So just to finish then, my key messages are, first of all, that public responses have been key in this public health emergency. So behaviour really matters, but it's not just about behaviour. I mean, the more I look into this as a psychologist, the more I can see that it's not only psychology, there are also these practical material factors, and there's a real danger sometimes with over-psychologizing when in fact material support and organisation is what is needed. And I said that where we see variations in adherence, some of it can be explained by events, actions by the government which impact upon some of the predictors of adherence, including the group process predictors. If you want to read more about this, I don't know whether you're going to share my slides or some of my material, Catherine, but there's a couple of very short articles which elaborate the points I've been making today. And these are my collaborators and my website and my acknowledgements. And thank you very much.
Thanks a lot, John. That was a really interesting talk, and I can see that in the chat there are already a number of questions. Gert has been keeping an eye on it. Gert, do you want to just quickly introduce the first question, the crisis one?
Yeah, I can do that. Thank you so much for your talk. But let me try and combine two of the questions in the chat in one. So in crises, many measures are often quickly set and adhered to by the larger public. And adherence is also dependent on how general these measures are. And it could be the case that people choose the relevant sets of measures that are relevant to them. And a sort of a more specific case of this would be, do you think it's also relevant that people adhere to certain rules or not because they are worried about the development of their children, for instance? Do you think that is also an example of adherence, predictor of adherence?
Well, certainly, yeah. I mean, it's a kind of broader point here about relevance, isn't it? Because as I think most social psychologists today would accept the kind of social identity idea that we have more than one identity. Right? We're not solely defined by our personal identities. So you can imagine. I've got my identity. I'm a lecturer. I'm an individual. I'm John. I'm a member of a community, and all these things have relevance, right? Now, of course, being a parent is a very strong and enduring, quite a powerful identity that might override others in determining what counts as relevant, and what you respond to. But if you look at the things that people are asked to do, most of them are not for their own benefit. I mean, look at young people. Most young people are not directly affected by the pandemic, and yet they, like everybody else, are being asked to and have indeed adhered to most of these regulations. So, and what's going on there? Because if they were thinking solely in terms of their own personal identity and their own interests, they could quite rationally and reasonably say, well, it's not going to affect me. I'm a fit, healthy young person. I don't need to bother. But for the most part, I know that young people sometimes do break the rules, but for the most part, young people have adhered. There's lots of evidence to show that. And why? Because at the level of the community, there's the threat is relevant to them that way. So so we have got different interests depending upon who we are, but who we are itself is a variable.
Okay, thanks a lot. There was another question, well, there are a lot of questions, but one of them is whether it would help if next to non-financial help, the rules for self-isolation would become a bit less strict. So, for example, allowing a walk outside alone at certain hours.
Yeah, that sounds a nice idea. Yeah, I suppose what I'd say is what we know about the reasons that people break the rules tend not to be things like going through. I have heard of things like someone walking their dog, but other than the things I mentioned, because I mentioned people feeling that they had to go to work, right? People not knowing the rules, people thinking that their symptoms were mild or disappearing. But the other one is going to the shops, right? So it's not going for a stroll for your well-being. It's more practical things. So I mean, those things they could be helped by other people. So it might be that having a bit more flexibility might help, but I don't know any evidence of that, because all the evidence is around these practical knowledge factors being the reasons that people are not adhering as much as they should.
Thanks a lot in the chat as well by the person who asked the question. I see that someone else is asking about and I've had this question actually asked to me a lot too, about the developmental consequences of this pandemic for children under 16 years and whether that was your target group as well. Whether you can say anything about that, but I think you probably focused largely on adults in the samples you've considered.
Yeah, no, I can't really talk about that. I mean, obviously there's been a big debate about the mental health impact of the pandemic and of being off school. But some of the evidence I've seen suggests that it's the pandemic itself that is a greater threat to the mental health of young people than being off school. Even though being off school itself is very damaging, not only for their mental health, but for their prospects.
Okay, thanks a lot. There's another one you mentioned that national and family identification play an important role in physical distancing. Why do you think family members are important, and how does that go hand in hand with community initiatives like mutual aid groups? And yes, I have a question too, but I thought it was linked to that, but I'll just wait. Yeah.
Well, the general point about the roles of these levels of identification ties in with what I said earlier, that one of the main motivators is not my personal interest, but my concern for others, because there's a very clear gradient, isn't there, in terms of age and vulnerability, right? So and it's not just young people; it's most of us. Most of us are doing this not for ourselves personally. Right, there was a change in the UK government messaging in the early months where they started off. They said something like, "Stay at home to look after yourself," or words to that effect, quite similar to that. And then they changed it to "Do it for others, do it for your community, do it for the NHS." And actually, that second form of messaging got more traction, and it got a better response. So this is why we find these studies showing that different kinds of identification are predictors of adherence to many of these measures, because caring for others is a motivator. As for why family identification was predictive in one of the studies, I mean, that one did look at community identification as well. And I must say there are some differences between the behaviours and the findings that I can't really explain. I mean, we carried out a study ourselves where we had 3 waves. So it's one of the better designed studies. We had it before the pandemic, after the pandemic, and we had identification with the community as a predictor, and the DV was adherence, and community identification did predict adherence, and that was pretty strong. But that measure of adherence was a rather crude global measure, and when you start splitting it up into the different behaviours, you find something different. So the study that I mentioned that found that family adherence was a predictor was looking specifically at distancing. So there do seem to be slightly different predictors, kind of identity predictors for different behaviours, and I haven't quite worked out why that is yet. So the second part of your question was about mutual aid groups, and what was that again? How does that link with this?
Wait a minute, I'm just looking for the question again, sorry. Why do you think these family members are important, and how does that go hand in hand with community initiatives such as mutual aid groups? But I think you've answered that too with your response.
Yeah, no, there is a bit more to say about mutual aid groups, because there's a discussion in
and the point, sorry, he just this was Justin's question, he just added, because family members aren't always in the community, and I think the underlying question is what motivates people to act in favor of their community, because you've been doing research about why people would remain within these within such a group, but what actually motivates membership thereof. I think that's a very interesting question.
Yeah, there's a long-standing debate in the research on these disaster communities and in community resilience more broadly around the origins of the kind of supportive behaviour which is often witnessed after disasters. Because on the one hand, you get these kind of social capital accounts, and in the social capital account, you've got existing relationships, interpersonal connections, bonds of trust, good relations that you've built up over time, right? And when it comes to the crisis, draw upon those bonds, those trust, and that is the basis of the support that people get. Right, so that's one model, and that model is used. It's more sociological than psychological, associated with Putnam, also with Bourdieu, and it's quite heavily. It features quite heavily in a lot of policy documents. On the other hand, there is the emergent group explanation, which says that these relations are actually quite new, and that's the model that we've worked on most, where we find that people experiencing an emergency or a disaster together feel grouped together in a kind of common fate sense. We're all in the same boat, and that is the basis of seeing these others as at one with us, or seeing them as an us. So those relations are completely new, and the evidence I've seen so far on mutual aid groups is that it's a bit of both. I mean, some of my colleagues just finished an interview study with mutual aid groups, and they found that some of them were defined by the local area. So there were people in a street, for example, and so that defined them. That existing connection defined them. But at the same time, through the through the pandemic, they were developing new connections. And they also sought to remake that community identity in a new way. So certainly in this case, there is a bit of both an existing bond, an existing motivation, if you like, to help others, but also a new bond, which comes from the new people you're connected with as part of this new group.
Thank you very much, John. I think we're going to have to leave it at that because because of time. But really interesting, also interesting answers. Thank you. We now have a break just of 10 minutes before we continue with Pontus. So we'll be starting again at 11:55 in 10 minutes. So I look forward to seeing everybody back again in 10 minutes. We're about to get started again. Maybe Pontus, I've just asked your zine to stop the break slide, and then you could already upload your presentation. Doing that now. Pontus, I think you can go ahead now, at least with uploading, and then we'll just wait because it's not 5:2 yet. Yeah, that looks very good. Thank you. Wait another minute because it's not 5 to 12 yet.
I've unmuted myself. Can you hear me?
Yes, I can. Very good.
Thank you.
And for those who are here, just as a reminder again, at the end, so we'll have questions after every talk, and at the end we'll have a panel discussion with sort of broader questions that we'd like to ask to John, Pontus, and Michel. If you have any contributions for that panel discussion, broader questions that you want to ask the three speakers to answer sort of co-jointly, then just let us know in the chat, maybe add this is for the panel as we go along, then we can prepare for that already. We've also prepared questions, so if you don't have any, it's not a problem. Hey, it's 5 to 12, so I think we can get started again. Well, welcome back, everybody. We've had John's presentation, and now we're going to continue with Pontus. So I give you the floor, Pontus.
Thank you, Catherine, and thank you to the organizers for putting this together. I'm honored to be here. And what I want to talk about today is a project that it's still live, much like the pandemic. It's still going much longer than we all thought it would. And this project, what I'm going to talk about today is mainly a method or an approach that we're practicing with. And I'll end with some data. But what this ultimately is this is a large-scale psychological study with cross-cultural, longitudinal, and integrative data science components that sprang up rapidly once the lockdowns hit and vastly expanded in order to reach our project goals to a team of over 100 international psychological and data scientists. And there's some features about this that I think are important to talk about, because if the theme of today in many ways is how can academics, we ordinary mere mortals, regular citizens, how can we engage in crisis response? If we're not satisfied with waiting for governments or fellow humans to save us, how can we be agents in a situation where we are also very much the victims and suffering through the crisis with everyone else? Now, with regards to a pandemic, unlike a lot of other emergencies, pandemics play out over a longer period of time, and that gives us more time to actually study us and each other while it's playing out. But the starting point for something like COVID-19 is maybe not that much different from a lot of other emergencies. Number one, there wasn't much data, at least for psychologists, because in our opinion, the last comparable event was the 1918 so-called Spanish flu pandemic, right? And by that point, psychology was still a young science, or we didn't have much to go on there. And as maybe many of us saw, if we were trying to follow news and science early on in the pandemic, it wasn't clear what theories or models or factors are most relevant to this kind of a problem, especially if it's a problem where suddenly everyone needs to follow a similar set of rules and guidelines for behavior that are extremely disruptive. Now, for me, as Catherine pointed out earlier, my background is in social and cognitive sciences. And so what I saw from my point of view in this situation was this was a grand, terrible, natural experiment in fear and frustration. And that's what I saw. I saw a huge quasi-experiment setting itself up. And there was already movement from multiple universities like Johns Hopkins and Oxford setting up these extraordinary databases for virus tracking and policy tracking. And it seemed like something that we could do, especially given this extraordinary team that we had here. And so we reached out with this idea that, okay, we need to set up a design where we can somehow rapidly distill out of countless variables that we can think of the most important predictors of some outcome of interest, which in this case would be, say, at least self-reported compliance with World Health Organization guidelines, which at the time had to do with social distancing, self-isolation, hand washing, much of which John already talked about. The challenge was that we'd actually been setting up a pandemic study for weeks. I worked with some brilliant students who saw the storm clouds on the horizon, and and everything I'm talking about today is by their generation. And And we had set up a study, but we were focusing on an internet-based study in one country with one sample. And it wasn't until the lockdowns hit us, when we all had to go home, that it became clear that we had to go much bigger than we'd ever imagined. And we have to go broader. I mean, a pandemic psychology, even as John points out, it's not just happening at an individual level, it's happening at all kinds of different levels. And so, realizing the task at hand, here's some pictures of several members of the local team. There are more, and we had some wonderful support from like Angels from the Sky from the Sustainable Society. I also reached out to a colleague, Jocelyn Bélanger at NYU Abu Dhabi, because he had a broad network of collaborators who typically study violent extremism and terrorism. So Jocelyn agreed to get involved in this and turned out to be an extraordinary leader in so many ways. And we were able to collectively build up rapidly build up a massive team of fellow scientists who are willing to conduct survey operations all around the world and get us to this sample size. So, in the tens of thousands, which is kind of difficult for psychology, especially being such an unfunded or underfunded science. But all that came together rather quickly. And so what I want to share is this is sort of our workflow model. We had to organize in some way. And so, if we think about the principal investigators, one here and then one at NYU Abu Dhabi, we had this bird's eye view of everything going on. But on the one hand, we have a team managing survey operations around the world. And keep in mind, it wasn't just the initial cross-sectional survey, but it was longitudinal. We used this platform of participants who signed up early on as a recruiting point to have them do weekly and then eventually monthly follow-ups, which we're still doing to this day. And they interacted closely with the countless global collaborators who did translations, data collection, tried to get funding to collect more participants and so on and so forth. And they were distributing a survey link that all that data would come back to our own servers, run by our data managers here, which are PhD students here at Groningen. And while we were putting all these pieces together, of course, all these collaborators, they weren't just collecting data so that we could do something. They wanted to do stuff with the data as well. And so we had to set up an internal board, and we had to set up rules for how people could submit analysis proposals, see what others are doing, write papers, send it to this internal board, which is an independent team of senior scientists whom I deeply admire and respect. And I'm actually amazed at how they were able to continue doing their work. And they would take these papers, send them out to this global collaboration for sort of a crowdsourced peer review, and then they would give the green light to submit papers for publication. And so this is kind of our workflow and output model. Well, meanwhile, I had my own interest in this whole project, and it had to do with this idea about including integrative data science. And fortunately, early on in the pandemic, a large group of data scientists were coming together in this Data versus Corona organization. And I reached out to them. I say, hey, here's our project. Here's what I'm trying to do. Is there anyone interested? And Dr. Casper van Lissa at Utrecht University in developmental data science stepped up and took the lead there. And while we were conducting these massive survey operations in March and April and May, Casper's team went out searching for external databases that we could link to individual participant data, which we could do if we know what country they're in and if we know when they do the survey. We have a lot of information that lets us link information about where the virus is, how tight are the lockdowns, what kind of healthcare infrastructure is around them. These kinds of factors that may somehow trickle down to influence individual willful behavior when it comes to pandemic response. So I just want to narrow in on that particular analysis, that particular study. And so if our research question is, what's the most important indicator of compliance with World Health Organization guidelines? What they did was we vastly exceeded our expectations, but we did want to get at least 50,000 participants, and we got there. And what they did was they picked basically 28 countries with the largest sample sizes, and they were going to set up a large machine learning analysis, which is basically, you can use machine learning to throw a whole bunch of variables into a supercomputer, let them battle it out for supremacy to identify and then rank order basically the strongest predictors of your outcome variable of interest, ranked in order of basically effect size. And so that could tell us kind of what's the most important topic area that maybe we should look at if we want to rapidly distill variables to maybe provide some useful answers in the middle of a crisis. So we designed the survey in such a way that we went broad. We used ultra brief measures to try to capture a lot of different themes, both intrapersonal factors, psychological factors relating to affect, emotion, well-being, job insecurity, financial strain, various social psychological variables ranging from attitudes towards society, perceived norms, beliefs, trust in government, but then also things about attitudes towards immigrants and these kinds of factors. And then, of course, various virus relevant concerns related to health and even to their personal economic situation. Well, those variables were then linked with about 30 database variables that the integrative data science team had identified as potentially relevant. And so we ended up with 115 predictors. And our outcome variable, which we were able to lump these three items together, it turned out to be a unidimensional construct, so they could come together. Basically, keep in mind, this was before masks, as John pointed out, before masks were widely adopted in many areas of the West. Washing one's hands, avoiding crowded spaces, self-isolation. These were three behaviors that we identified as things that we were interested in. And those came together and fit together in a scale. And various external database variables was anything from confirmed cases and deaths due to COVID-19, global health security, so pandemic preparedness at the country level, healthcare infrastructure, various governance indicators, and then, of course, how tight the lockdowns there were for that participant on that given day based on the country that they were in. So, what did we find? Well, I was happy to see John's talk because overwhelmingly, there were two top predictors, and I'm sorry for these short labels. If you're interested in in reading more, there's a link down on the bottom. But the number one most powerful predictor by a wide margin was what we call an injunctive norm in social psychology. This idea, an ought norm, that people in my area should be engaging in these social distancing behaviors. The should norm. That was number one. If you look down to number 7, whether or not people do social distance, so this perception of whether people in one's community are engaging in these behaviors, yeah, that was also an important positive predictor. At least it was in the top 10 of 115, right? But should, these ought norms, was overwhelmingly number 1. And the second most important predictor by a wide margin, and this is disturbing if you're interested in human freedom, but keep in mind, this was an extraordinary international sample. It wasn't just Westerners, it was people all around the world from all kinds of governments and under different kinds of regimes, was their attitudes towards mandates, these COVID restrictive measures, basically how supportive a person was as to whether or not they supported mandatory quarantines, mandatory vaccination, in other words, vaccination without consent, being able to report suspected cases. So imagine if you think your neighbor's sick, you can call up some authority to go take them away or go test them. So but people who strongly endorsed those kinds of measures also tended to be the ones who themselves engaged in these willful behaviors such as hand washing, self-isolation, and so on and so forth. Now, there's a lot going on here, and machine learning is tempting because you want to provide an interpretation for every variable you see, and I don't know if we can do that here, but those top two I think really stand out because this tells us that this pandemic wasn't simply a health psychology issue, that this is also very much a social psychological challenge. And as you can see here, there were even country level factors that played a role. Proportion of doctors, or number of doctors per 10,000 inhabitants in that country, even the virus spread. So like, you have to wonder about directionality, but the number of deaths and recoveries and whatnot, those were also negatively related to these individual behaviors. So what does this tell us? So how do we study a pandemic in real time? Well, I mean, I just presented it in just a few minutes. The practical reality was absolutely awful, and in many ways it still is. This is an extremely challenging task, and it's not really designed for the modern academic environment or incentive system, because the most likely outcome of this project was failure. Just trying to get out of the lower orbit at the institutional level was hard. Trying to keep us in orbit has been hard. Nevertheless, scientifically, we're getting to learn things about pandemic psychology while it's happening. We have an unlimited amount of ideas that can be tested. We're also creating a massive psychological database for future reuse, data linking. And some of the talented members of our team even created a Shiny app, so basically a data visualization tool so the public can go and play around with the data. But for me, ultimately, this is a test case in rapid response research, individual-led, citizen-led research where we're not waiting for institutions, granting agencies to respond or provide their approvals. No, we just pick it up and we go for it until we fail. And sometimes you might succeed. We'll see if that turns out to be true. Now, I want to make clear that this project was led by young people. These 5 people here, they are the absolute creative force behind this. I mean, their work has been incredible. I'm so proud of them. And of course, I'm grateful to, as you know, after the project launch, we were able to stitch some funding together to get more representative samples and these kinds of things. And that's been absolutely wonderful. So I want to draw attention to these individuals because they are the ones who are going to probably save us from the next crisis. So if you're interested in the results, here's the full list with some descriptions. But I think I'll stop there. Thank you.
Thanks a lot, Pontus. That was very interesting. At the moment, there aren't yet any questions in the chat, so I encourage everybody to pose their questions. I do have one. I'd be curious on your perspective on this. It may be a difficult one, but so a while ago, there was this discussion in the Netherlands about how it can be that infection rates in Germany are lower than in Netherlands. And one of the points brought in was Andreas Voss, a bacteriologist, I believe, living in the Netherlands, but he's German from origin. He said, well, this is just cultural differences. The Germans are more disciplined, therefore more likely to adhere to measures. And I was curious whether you can, given your database, you should actually be able to give an answer to these quite kind of explanations, because in a way you're absolving a country of blame by saying, you know, we can't really do anything about it. This is just the nature of the country and the people in it.
Yes, so the important thing about this kind of a study, by teaming up with a lot of people and going international, is that it becomes a multi-level project. So the analysis I just presented isn't true multi-level analysis, but what that lets you do is it lets, and a lot of our researchers and papers, some of them published, some of them still under review, they take this multi-level analytic approach. And what that basically what that means is that we can look at both individual level processes to see what's kind of common across humanity around the world, right? And if we're thinking about issues of well-being and loneliness and some of the misery we all experience, that's valuable. But you also get analyses at the country level to see what countries differ from each other. And these analyses are orthogonal, right? So you can really learn in the same analysis about individuals worldwide, but also about different countries and where things might emerge. So I think there's some truth to that, and norms are certainly part of it. But I mean, even as John pointed out earlier, this isn't just a psychological challenge. I mean, this is also about a structure and affordances for action that plays a role in it, and material needs. I mean, we see that in some of our own analysis. In fact, we have one paper under review where, by the looks of it, people's economic fears, their personal economic situation, was really a more powerful predictor of certain outcomes than their fears of actually getting sick. And as someone who's not in a risk group, I can kind of understand that. Now, we're all in privileged positions, or at least most of us, in an academic world. But I think that's worth paying attention to. And if you look at countries like Germany and the Netherlands, really, to be honest, and much of Europe, I mean, the amount of social support and this massive safety net that exists here, might have wondered would have shielded us from a lot of the pain, but maybe that didn't actually happen.
I might have a follow-up question. Thank you so much, Pontus, for this great project. Honestly, very impressive. And one question I had is, of course, the value of doing this real time and getting sort of quick results is then subsequently not to have it stalled by the academic process of publishing, but actually to use those results immediately to get it into policies somehow. So have you thought about doing that, making those connections? Because indeed, it's a bit of a shame that we have to wait 3 years before you can say what the findings were, so to say.
Every prior generation has failed us. That's just a fact. And these data should have been here, but I mean, there wasn't a pandemic for this emergency. The fact is that a lot of people who got into pandemic research understood that we're not going to be able to save ourselves this time. We want to save the next generation. We want to give them everything they need to make better decisions. We applied for a lot of grants, and especially here in Europe, there was this idea that you should immediately take your findings, turn them into interventions. For those of you who believe in that, more power to you. But that's incredibly dangerous. And there's been some interesting there was one in Washington Post that really talked about this question of, especially if we're hyping up preliminary unpublished results, going out in the media saying, hey, look, we found this thing, and the public can't differentiate between important and unimportant variables. Just because something's statistically reliable doesn't mean it's what we should be focusing on at that particular moment. There might be a reflection period about how eager we all are to make a difference now, as opposed to doing what we are really good at as scientists and academics, which is to plot a course for humanity's future. And that's what I hope that we're doing, and that's what I hope that many of my colleagues involved in this kind of research are doing. Thank you, Gert.
Thanks a lot, Pontus. There's one more question that we could ask. We have only 1 minute, so if you could answer it shortly. So there's somebody here asking the most proximal motivation to engage in behavior is whether you feel your behavior is or has been effective to take away the threat of oneself or for oneself or for another person. Does that work is the question. So that kind of motivation, this effectiveness or efficacy. And did you assess that is the question?
Yeah, so if I
actually a bit in his talk. Yeah.
I think the question, if I engage in this behavior, will it be efficacious at, say, preventing infection or preventing all this kind of stuff? Yeah, so there's a whole realm of psychology that we just sort of ignored, which is health psychology, and there's theories of like planned behavior and some of these that we got to capturing later in the longitudinal with specific research questions. But this is the danger of rapid research. I mean, you pull together the minds that are willing to work with you, and you put together the best you can, and then you have to acknowledge that there are limitations. Absolutely. And even with machine learning, this one result, I wouldn't take this to the bank. Absolutely not. What I would hope is that there are 5, 10 other studies just like this one that measure these plus other variables, and if they all end up revolving around injunctive norms or something like that, then that is meaningful information. But it's a great question, and of course it is. It's important to know that. I can't answer it.
Thanks a lot.
Thank you.
And says the person in the chat as well. So then I'd like to thank you very much, Pontus, for your talk and a nice discussion as well. I'd like to give the word to Michel now. So Pontus, if you can stop your presentation, then Michel can get his started.
Great. Let's see where it is.
Looks good, Michel.
Great, and the microphone is on, so super. Yeah. Well, first of all, thank you, Catherine, and your team for organizing this session. I really enjoyed listening to the previous speakers so far, and I'm really excited to continue to talk about cross-national comparisons and mechanisms we see and how they can be explained, but that in itself would require a different conference, I guess. The title of my talk is it's more on community engagement and decision-making during the COVID-19 pandemic. And if you, I will expand some of the lines the previous speakers started with, and that has to do with dynamics of the crisis, the importance of behavior and adherence to behavioral measures, but also what Pontus said. I will also continue the part about the role of academics in a crisis like this. And in my talk, the role of academics is not only about conducting analysis and formulating advice for crisis authorities, but also in how academics and social scientists can serve as an intermediate between stakeholders in society and communities and decision-making process. So in terms of similarities, that is how my talk will proceed. A major difference is that my dependent variable in the end is a bit different, because I'm more focused on vulnerabilities in a broad sense. What makes people vulnerable, what makes communities vulnerable, what makes the crisis system vulnerable. And in the end, I think where we can meet each other again is that the behavior of individuals in society is part of that vulnerability. So that's for a starter. First, some background, although Catherine already did an excellent talk in introducing me. Since December, I started as a professor at the University of Groningen. And besides my position at Groningen, I'm also research coordinator at Nivel. So some of the colleagues in this group, so good to have you here. And I also work at the National Psychotrauma Center. The idea of my combination of jobs is actually, has its purpose is to learn from previous disasters and crises in the Netherlands and to maintain a knowledge base for future events. So in the past, for instance, we learned a lot from the fireworks disaster in Enschede in 2000, a cafe fire in Volendam 20 years ago, but also more recently the MH17 disaster in Ukraine in 2014. These were really large-scale events that affected the Dutch society a lot. And the knowledge base created through these events is currently also used for provision of support during the COVID-19 pandemic in the Netherlands. I will shortly go into that later. I also think it's relevant at least to show you a bit of my academic background, because in the end, this type of history is really, well, it determines your focus in your everyday work. So in my case, I studied public administration in the past, which is really linked to understanding the interaction between government and society and public policy issues. I conducted a PhD in social and behavioral sciences in Utrecht, and did another dissertation in Innsbruck, which was really about cross-national comparisons of countries and how culture is linked to mental health, and also how service provision differs across regions. The organizations behind my chair in Groningen are ARC, National Psychotrauma Center, NIVEL, but also the National Institute for Public Health and the Environment, and the Institute for Physical Safety. As you can see, the last two have the best atmosphere when it comes to greenery. And since March last year, I was involved together with a broad team from the National Institute of Public Health, the Municipal Health Regions, the National Psychotrauma Center, and colleagues at NIVEL, together with partners in all types of other organizations in the Netherlands, to make sure that we can actually apply the lessons from these earlier disasters and crises. And what we did is, being in a continuous dialogue with national and regional authorities and see where we can support them. We conducted rapid needs assessments, and it's a bit like Pontus said, and under time pressure, you have to do it with the material you have. So you could also call this health research light, using available samples and instruments that are available pragmatically to keep track of what needs and problems are in the general population and particular risk groups or vulnerable groups. We also created, and this is one of the recurring lessons from every event, that it's important to establish a one-stop shop where people can actually come together and find answers to all types of questions emerging in the wake of a disaster. And we prepared the real health monitor, which is already starting in its preparation phase, but it means that for the coming 5 years, together with all 25 health regions in the Netherlands and available registries, we will be tracking the physical, the mental health, social problems of Dutch society and different groups in it for the coming 5 years at a national and local level, with the intention to adequately inform policymakers and practitioners. The rest of my presentation is divided in two parts, and the first part is more theoretically, and later on I will go discuss what this means in the light of COVID-19. And one of the dominant models we use to understand what crisis management means in the light of public health and health threats is we have this model with different steps through time. Well, and at the center is health, mental health, physical health, well-being, functioning. We have tons of epidemiological research pointing at the relation between all these different domains, and you can use other diagrams or models, but essentially it's mostly about mental health, physical health, well-being, and functioning. What we also know from epidemiological literature is that in the end, exposure to disasters and environmental hazards has a negative impact on health. And although this is also something which is really complex, because most of the knowledge we have on disaster health impacts comes from what we call the sudden onset events, terrorist attacks, airplane crashes, earthquakes, hurricanes. But what we are experiencing now, and also the group I work with at the University of Groningen with Catherine and colleagues, we are working on understanding the creeping crisis, the slow motion events, without a sudden onset, but with a ongoing chain of stressors, like the earthquakes in Groningen, but also now the COVID-19 pandemic, if you would call it like that. And what crisis management entails across the timeline is actually a series of tasks. And it starts with sense making, what's going on here, decision making on what to do, the coordinated implementation of efforts, meaning making, the story you tell towards the communities, towards societies, towards affected individuals, account giving in the end, and learning on behalf of future events. If you combine that with what a public health response should look like, then you get a combination that the sense making is really about understanding needs and problems of people, understanding risk and protective factors, which in fact is understanding vulnerabilities. This is the part where vulnerability assessment plays a role in the beginning of the crisis life cycle, and making decisions to, using your capacity and always SARS capacity wisely to come up with a coordinated set of efforts to implement actions and decisions, and in the end tell a story to society that also does justice to emotions, feelings of loss, feelings of neglect. We will come to that later, because it's also part of the disaster dynamics that at a certain moment there's a bigger need for recognition because social support is deteriorating. Account giving will be a lot easier if you do a proper job in the beginning of the timeline, and the learning obviously stays the same. In this timeline, there are actually three main obstacles over time. Obviously, in every crisis, there is a typical lack of information. You don't know what's going on. You don't know what the risks are. But at the same time, you're really craving for information that is not available. Later on, and we will also go deeper into that, there's a deterioration of support or social support. Perhaps that is even linked to what John called, you have these emerging support systems that indeed emerge in the wake of the event, but at a certain moment there's this disillusion, and where people tend to lose hope, trust in each other, have difficulties in understanding how to get out of this situation. There's lack of trust in the government, and eventually this will result in an increase in criticism. I can still remember from the MH17 disaster that right after the national commemoration, which is shown here, this is more like the meaning-making part, that you organize an event where together you express your sympathy for the people who lost relatives and dear ones in the crisis. That at the same day, the day after, that one of the news organizations in the Netherlands, I don't know how it's called in English, but we call it the WOP, Wet Openbaarheid van Bestuur. That's a law that gives everyone the possibility to get all the official documents from government organizations to get a transparent view of what went going on. And I really found that a very typical next step from meaning making to account giving in a setting of increased criticism. Community engagement. It's really a hot term. You can see it in a lot of WHO documents in the literature. There are multiple Lancet articles about it. What we see as community engagement, it's involving communities, involving stakeholders in decision making, in the planning, design, governance, and delivery of services, aimed at improving population health and reducing health inequalities. So in the end, this is also a definition that allows for a smooth connection to my previous model. And of course, there are models on community engagement itself.
Michel, I'm just going to interrupt very briefly because you have about 4 to 5 minutes left, just so you know. Yeah.
Well, in that case, I think I need to speed up. In the ideal picture, theoretically, you create a mechanism of social of community engagement that actually contributes to crisis management in such a way that different perspectives from different stakeholders who are affected in a crisis are included in the task through the life cycle, so that in the end you can use that to reduce vulnerabilities. Managing the COVID-19 pandemic in practice In a lot of the discussions on patterns, the outcome measures are often like the number of cases, the number of deaths, and I took these two images from Johns Hopkins University of United Kingdom and the Netherlands, and there you can clearly see that the second wave is really more intense and longer than the first one. And especially what I also find interesting is while we were in the first wave, we had all the idea, well, this is already very bad and we don't know where it's going. But no one at that moment could ever anticipate how it will look like in the second wave later on. Other dilemmas recurring is that there's a continuous tension between the long and the short term, like maintaining your healthcare capacity, acute care, versus dealing with all the long-term impacts of a set of measures like lockdowns, curfews. What you can also see, and this is linked to the index from stringency, that multiple measures have been implemented that can vary between relaxed and strict. Communication campaigns, social distancing, vaccination programs that are being implemented at the moment, financial support programs to overcome the lack of income. So these are patterns in which all behavior matters. So this is actually what links this part to the previous speakers. Another pattern, and that this is linked to the disaster, the emotional conjuncture of the disaster, where in the beginning there's a lot of support with emerging support organizations, and later on there's the disillusionment that we already briefly discussed, that you lose faith, you lose hope, you're not happy, and in the end, if you look at different trust barometers from the last couple of months, you can really see the difference between the trust in the government and the willingness to adhere to different measures compared to the more like honeymoon phase in the beginning, where people were really very positive towards healthcare professionals and had trust in the government. Vulnerabilities exposed during the crisis have to do with vulnerabilities within societies. That has to do with risk and protective factors that we know from classical literature about on what social determinants of health. But also, and I really like the editorial by Horton last year on the syndemic, the point where the pandemic really interacts with deeper inequalities and existing problems. So this fits the traditional idea that vulnerabilities are exposed during a disaster or by a disaster. System limits, critical thresholds, the fact that our healthcare capacity at a certain moment is not ready for the surge of new patients. Also within crisis response systems, we also experienced that a lot of our preparedness was based on the previous disasters and terrorist attacks and cyber crisis, but not on pandemics. Oh, what that was, but my presentation still visible?
Yes, it is, but you need to fly them in again, and you have about 1 minute left, Michel.
Okay. Emergent organization coordination issues, of course. Too many organizations with little information that need to act. Complicated, ambiguous public communication. I think John already went into that extensively, also referring to the Cummings case and the decline in adherence. Stay home versus stay safe. The now is very dominant in the planning. Few organizations found the time to focus on the long term and take measures for that, while that is actually part of our guidelines, but apparently very difficult to apply. We are also struggling to engage stakeholders in decision making, especially because a lot of the crucial stakeholders and probably the most vulnerable people we are worried about are very difficult to get in the radar, on the radar. Yes, the vulnerable are invisible. And I'll skip this part about the EU project, where we are actually conducting pilots in 10 countries to learn from vulnerabilities and through community engagement approaches with different tools and instruments to produce tailored policy recommendations for the 10 countries that eventually will be compared. And we hope to get a lot of information from that on how you can in different contexts, different country contexts, different community contexts, can actually apply vulnerability assessment approaches with stakeholders to inform crisis management. Have the time and interest, you can visit the website Sonar Global EU. It's funded by the Horizon 2020 program. And our focus was changed during last year because of COVID-19, because our emphasis was earlier on Ebola, measles, and antimicrobial resistance, antibiotics. So very shortly, my conclusions. It's one slide. Well, the COVID-19 pandemic clearly challenges societies across the world, exposed vulnerabilities in public health and governance. Social scientists can contribute to sense-making and decision-making concerning vulnerabilities using community engagement methods. There are challenges we need to address. They have to do with intervening in the dynamics of the crisis timeline, a timeline that also affects the legitimacy of the response, especially when it comes to a loss of trust. Keeping track on the most vulnerable groups, providing adequate support to them. Preventing, mitigating the post-disaster disaster, or in the Netherlands, de ramp na de ramp. The new problems that are caused by our approach to deal with the consequences of a disaster. And of course, preparing for the next crisis. So I did an attempt to speed up my pace, and I hope that we're still a bit within the schedule.
Okay, thanks, Michel. We have time for only one question because basically we are through our time for your talk. I think Gert had a question, if I'm correct.
Thank you so much, Michel, for this great talk. On one of your slides, you pitted sort of the medical and social sciences against one another. And I was wondering whether you can reflect on that as your role. Like, what kind of opposition do you see there, and what kind of difficulties do you face there?
Thank you. That is a very good question. And I also realized that they are not entirely distinct worlds because there's an overlapping area, of course. This is also linked to the EU project I was referring to. We got the funding from the EU because there was the call was written in such a way that they wanted to use social sciences to compensate for shortcoming in traditional knowledge from medical science, infectious disease science. So for that reason, understanding context, understanding behavior in communities, Ebola crisis, for instance, and also the AIDS pandemic or epidemic, really learned us the importance of understanding behavior, also not beyond epidemiological knowledge on risks. But you can also see and this is more linked to the Netherlands, we have discussions on how our crisis advice structure is organized. And we have this outbreak management team, which is mostly occupied. There are a lot of experts there from the more traditional infectious disease sciences, if you would call it like that. And there's also, especially in the summer months, as you can recall it, there was quite some pressure on breaking that OMT, that outbreak management, up a bit and expand it with additional expertise and disciplines from all different aspects of societies that are damaged or at risk because of the pandemic. So what I'm trying to do now is I brought in two examples of topics where social sciences and social science knowledge is complementary to the more traditional response to pandemics. I hope that this answers your question a bit.
Okay, thanks a lot, Michel. We're going to move on to the panel discussion. I already mentioned in the post, but in the chat, and I'm not sure how many people actually read that, but you can post broader questions that you would have for the three speakers. So the idea is that we engage in a discussion just more broadly. Before we start, maybe just to John and Pontus and Michel as well, do you have any, you haven't been asking yourself questions, but are there any comments or final points you would like to make, having heard the three presentations? If you have any comments, you're very welcome to make them now. Otherwise, we have prepared a number of questions for you as well. Yes, Michel?
Well, I would like to invite John and Pontus to to plan a meeting after this session to see how we can combine all the data sources into a coherent story that really brings our three contributions together.
That's a nice idea. I see some nods from the other two speakers. So we have Gert and I were prepared a number of questions that we thought would be interesting to discuss also because they were in some ways the reason for initiating this symposium. So Gert's question to Michel in some ways touched on this already, but I think in this pandemic, certainly in the Netherlands, one of the comments has been that it's been very difficult as behavioral scientists to bring what we know about, or what the knowledge that we can contribute to the pandemic, to actually bring that to government organizations or to have some input into how the pandemic pans out, so into policy. And so more broadly, my question would be, what have you learnt, the three of you, and maybe it's a question a little more for Michel and for John, how we as social scientists, or at least John, how you as a social scientist can relate to governments. And I know that you've been in a task force in England, so I'd be very curious to hear some of your experiences there as well, and maybe also advice for other social scientists. I mean, like Pontus has collected a lot of researchers writing papers about this, but how can we bring this out to the public as well?
Do I go first? Okay, so I think, the answer to that, there's a bit of echo there. The answer to that really depends on your national situation. I'll just briefly describe the situation in the UK. So we have a long-standing semi-permanent structure called the Scientific Advisory, I can't remember what it stands for. It's SAGE, Scientific Advisory Group on Emergencies. Right, so it's got a kind of changing set of personnel, and it's wheeled out at times of emergency, and it has subgroups, and one of those subgroups is called SPI-B, and that's a very strange name, but it's basically the behavioural science people, not just psychologists, but also anthropologists, criminologists, historians, and so on. There are other subgroups, one on modelling, one on the environment, and others. So the UK government, through its civil service, made the decision early on to have a subgroup, an advisory group that consists of social scientists. And that is a continuation of advisory groups that have existed before, because I've been members of other advisory groups on chemical, biological, radiological incidents, on preparedness, and so on. So it's a continuation of that. So that, it would seem, provides a kind of conduit for psychological research, social science research to government. Of course, it's not so simple, because the commissions we get, the things we're asked to do, are quite reactive. So we all come into this with views, with opinions, with knowledge, and we like to feed that in. But what we get asked to do by the government reflects their concerns. So we get questions and we have to respond. So it's quite passive. And because of that, and because the government weren't always taking our advice, they were doing things that went against our advice. I mean, I gave the example of the moving away from stay at home to the be aware messaging. That didn't come from us. And we've got communication experts, we've got health behaviour communication experts in our team, and they were ignored repeatedly. So that model is not, it's a bit unsatisfactory, it's too passive. Where is the space for social scientists to be a bit more proactive? So that, because of that, some of us also formed a part of Independent SAGE. So this was set up by the former UK Chief Scientific Advisor, Sir David King, and it consisted mostly of public health experts, and then there was a kind of behavioural science group attached to that, and that allows us to be more proactive, to talk about policy, to talk about what the government's doing wrong, which you can't really do within SPI-B, or except what you do in a personal capacity. So therefore, the other channel, if you like, or the other conduit, is the media, and that's what Independent SAGE does. It gets publicity for its work. It has a weekly broadcast where it goes through the data, the figures. It gets in the media, and this way we have influenced debate. and the government do respond to criticism when there's enough of it in the public domain. So two channels. One is institutional, and one is extra institutional in through the media.
Thank you very much, John. That's really interesting. Michel, do you want to reflect on that from the perspective of how it's organized in the Netherlands? Because I think I think you're probably a little better institutionalized than social scientists are here.
What I can mostly say about it is that it is really complex, of course, and I think it's a bit linked to what I mentioned earlier about the way advice is formulated in the Netherlands, and the discussion we had last year about involving different types of specialities and expertise. I'm thinking last year we had this in the summer we had a discussion about the red team, and that was like a counterpart way of formulating advice to the government. And I really think that advice structure should be like transparent, but what you could see there were quite some weeks that there was an increased pressure to bring in other voices in the decision making, and at a certain moment out of the nothing there was the red team that was actually legitimated by the government. And I thought this is in a way a good thing, because it creates a counter voice, like to prevent groupthink and to enrich your process. But on the other hand, it was not transparent at all, because no one knew where these people were coming from. And as you can see, my emphasis is mostly on the richness of the voices that you bring in your decision making. Was this what you had in mind, Catherine?
Yes. Yes. Thank you. I was at the same time also following the chat currently. So yeah, I think that is I mean, yeah, that I recognize indeed also some of the processes that John was talking about, like the red team, and also recently in the newspaper discussion even with medical scientists who were saying that they find it very difficult to be part of this institutional advice when at the same time they're realizing that their advice is not being followed, and how to deal with that. And that's similar patterns as John was talking about. So yeah, thank you very much. Pontus, did you want to add anything to that? Otherwise I'll give the word to Gert.
Well, what I might just add is I think what I was inspired by in John's talk was that community level efforts could be interesting in this regard, in a way for government to interact with people, because so in our research, in our lab, and we're not studying pandemics and other craziness, we're studying deprivation, frustration, psychological needs, the desire to be, we want to be the heroes of our own story. We want to be active agents who make a difference. And the challenge of a pandemic, in fact, I see Heidi even asked a question relevant to this, is that what we're asked to do is sit and do nothing. And that may not be consistent with how human beings function. We're probably not very good at that. It's gonna cause damage. But what that also does is that it gets rid of probably one of the most powerful resources that human beings have, which is the power of our own actions and our own ability to help other human beings at an individual level. And I would be cautious to put all of the emphasis on government to do that work for us, or have a population that's waiting for the government to tell them how to respond to an emergency. So that's all I have on that point.
Yeah, if I may follow up on that, thank you. That's a very nice point. That you've also said in your talk that that you didn't want to already use your findings to inform policy because they might not be reliable, and also you said that in essence we don't know how people respond to a pandemic because the true one was in 1918. So then there's sort of, to ask a provocative question, if it's up to you, then we don't really have any advice to give yet, right? Because we don't know yet, because this is for the first time that we're actually measuring it well, and that we try to understand how people respond to this behaviorally. So how do we navigate this uncertainty that we have in our scientific findings with a relatively new domain, and the fact that we also want to be relevant? And so maybe all three speakers can comment on that, but you particularly.
Well, so let me first react. So, in the US, you have 50 states, and the original idea was that therefore you have 50 different laboratories for government. Here in this pandemic, we got the same thing. We got every country on the planet, and in many ways, different states or provinces within a country, or even municipalities, all operating as labs. We're, as a species right now, collecting so much data right now on this disaster. And as far as pandemics were concerned, as awful as this is, in many ways, there are much worse viruses out there that, thank goodness it wasn't one of them, right? With the fatality rates being much higher than this one. So my opinion is that let's take this as a horrible tragedy. Let's learn as much as humanly possible from it and use all these different experiences and government responses, successes and failures, and then take it from there and work to solve it for the next time. Otherwise, we're just going to end up exactly where we were this time, flat-footed, different hodgepodge, solutions, and a public that's over time, understandably, distrustful and increasingly concerned. Yeah.
Now, John wanted to respond to this. I don't know whether you saw that, Gert.
Yeah, just briefly on Michel's point about whether we have enough knowledge or enough certainty to that argument that whether we should intervene or get involved. A similar argument was made in a paper in Nature Human Behavior, where the replication crisis teaches us to be humble. Problem is that if you look at the decision making, the rationales that drive government actions already psychology is in there, right? So when they talk about fatigue and they use public fatigue as a reason to intervene too slowly, too late in the pandemic, when they say the public are selfish, when they say the public are panicking, when they say don't tell the public, right? These are the discourses of emergency management over years that have led to bad decisions in emergency management, right? So psychology is already in there. The trouble is, it's not a psychology based on scholarship. It's a folk psychology, right? So our job, for all our caveats, is to say, well, this is the evidence as it stands, right? And this is why these folk psychologies are not evidenced well. So we have a responsibility, I think, to intervene and to let our leaders know what the balance of the evidence is and why some of these problematic concepts should not be used in emergency management and decision making.
Thanks very much, John. I guess I agree. I think it's really important that we do bring in our knowledge as we have it. And I mean, also given the examples that you gave in your talk makes it very clear to me, at least, also why how you can influence policy and or at least how decisions can go in the wrong direction. Like that alert example to me is a very nice one. I see that Michel wants to just comment on this briefly too.
Yes, thank you, John, for raising this point. And this is actually linked to a discussion we had this morning in the team for our EU project. Our objective is in the end to make sure that different perspectives of community stakeholders are included in the development of policy recommendations. But one of the major risks here is that by giving everyone a position in that participatory process, you might in the end damage bringing in evidence from experts, because I'm really curious, that's something we want to test. If in 10 different countries you bring in community stakeholders and work on what does this vulnerability mean and how can we resolve it, then you get this process where different interests are weighed. But if we don't do it properly, there's a big risk that this results in policy recommendations that are not evidence-based anymore, but at least reflect what stakeholders think is important. So what I'm trying to say is that empowerment becomes more important than evidence. And that would actually be a paradox, because as a social scientist, you want evidence to be in the process, but the process is shaped in such a way that it's more about relations, interactions, and empowerment. I hope that you all understand the dilemma I'm trying to pinpoint.
Thanks, Michel. Yeah, I'm looking at we have a question also within the chat. So I think, given that Gert and I have been asking questions now, it might be nice to also bring in a chat question. So this is about, it is a little more content. It's about, and maybe a bit most for John, but for all of you in a way, do you think the role of existing or emerging communities is different in the current pandemic compared to other disasters because of the limited social contact people have? For instance, staying at home regulations may on the one hand limit opportunities to spontaneously form new communities, and on the other hand, social isolation could increase people's need to reach out to others and make new connections. So this is a question about how existing versus emerging communities would relate to each other. We're seeing different processes here. I think it's probably, first of all, for John, a question.
It's a really great question, because it relates to what we mean by groups, how we understand groups, what we mean by communities. I mean, traditionally, if you think of the social capital approach, it is about physical, almost physical, tangible interaction of something tangible and physical, right? And a group is a group of people who all know each other and are physically co-located. But in social psychology, I think the dominant approach to groups now is a bit more cognitive. Now, our group are those whom we define as a group. I see myself as a group member, and that is the basis of my group behaviour. I mean, there's a practical question, because the traditional group in emergency, in the disaster community, would be people that come together, have meetings, do things physically together, and they're not able to do that. I mean, the mutual aid groups that we spoke to, some of them, they were not having any engagement in a tangible physical sense with others. There was a list of tasks, and they would be assigned their task, and they go about and do their activities that way. Others would get together in an office, but most of it, of course, because of physical distancing, was not possible. So they had to create alternatives. And as I said in my talk, communication, keeping people informed, and horizontality were ways of achieving that. But it's true that due to the physically distanced situation, some people were a bit psychologically disconnected from others. But going back to my opening response, that doesn't need to be the case. I mean, there's fantastic work by scholars in Groningen, right, which have shown that physically distanced people, distanced by interacting solely via computers, can be just as groupy in their actions and their cognitions as those who are physically co-present. So, the people that have organised and formed groups in the pandemic do it virtually, right? And that has allowed them to act in a group-like way. So the short answer is yes, it makes it more difficult, but people have found ways to create groupness, both psychologically and in terms of the way they coordinate.
Okay, thanks a lot, John. Do the other two want to respond to this point? I don't see any hands, so. Okay. Yeah. So you've been actually maybe one last question. No, I don't think we actually have time for one last question. Sorry, I had one, but it's already 12:57, so it might be nicer just to wrap up now, because otherwise we're going to run out of time. So I think we've had some really interesting, 3 sets of very interesting talks today, looking at the social scientific potential determinants of measure adherence, and more broadly the question of what can we as social scientists contribute to the discussion surrounding the pandemic, and then also Michel's contribution looking more at the public health side of this. So I'd like to basically end by just thanking the three of you for providing your perspectives and also for this very interesting panel discussion. When I planned the panel for 20 minutes, that I didn't want to let the symposium take more than 2 hours. I thought, with online, this online time, we all have enough time behind the computer, but I realized 20 minutes would probably be too short, and I think it probably is, because we see here that there are quite a lot of questions left still, but I hope everybody has anyway had enjoyed this interesting discussion, and I'd like to thank the three of you very much for your time. Normally we would give you some flowers and a bottle of wine right now, but we can't, so all I can say is thank you very much right now, and I hope thank you also to everybody at home who's taken the time to attend this symposium. And have a good day. And John has just posted some information if you're interested in looking at some more of his research as well. Okay, thank you. And everybody is saying thank you and cool talks. So goodbye, everybody.
Thanks, Catherine.